lying in a hospital bed, hooked up to countless machines, only prolonging the inevitable, your death. You've been diagnosed with a terminal cancer and given only 5 months to live. You're miserable, in pain, unable to care for yourself, and no longer able to live a life with any sense of normalcy. Do you want to spend the remaining months of your life with your condition only worsening? Or would you rather end your life on your own terms? Choosing the latter opens the door to physician-assisted suicide. This alternative to waiting for your illness to run its course is a controversial program in which a doctor will write a prescription for a lethal dosage of medication. Then the patient will administer the medicine to themselves, ultimately causing their own death. This is not to be confused with euthanasia, which is when the doctor actually administers the medication. Nonetheless, choosing physician-assisted death at the end of life deserves to be a viable option under the proper circumstances. The final stages of life, preceding death, are filled with suffering for the person. When people have only 6 months left to live, hospice begins treating them. The main concern of hospice care is not cure, but comfort. When people with terminal illnesses reach the end of life, their morale will suffer. The factors which positively influence their opinion on physician-assisted death are dependency and burden on family and caregivers, isolation from others, physical impairment, and loss of control of their life. Every person has the constitutional right to decide their own fate. The 14th Amendment to the Constitution guarantees equal protection of the laws. One of these laws prevents the infringement of certain inalienable rights. This includes life, liberty, and the pursuit of happiness, meaning each person has the right to decide all aspects of their life, including their death. Not only is it more sympathetic, but also morally justified that a terminally ill person has the opportunity to make choices regarding their medical care. In an article in the New England Journal of Medicine, a doctor reports the findings of a study in Oregon on the number of cases of doctor-assisted deaths. Between 1998 and 2007, 541 lethal prescriptions were written. Of those, 341 were effective. The participants had a median age of 69, were all Caucasian and well-educated, and more men than women chose death with dignity. The Journal of Law, Medicine, and Ethics argues that it is the responsibility of the healthcare provider to provide treatment options and information, then allow the patient to make their own decision regarding their medical care. Until this argument to preserve autonomy in the patient was made, it frequently occurred that the doctor would simply inform the patient of their treatment out of courtesy, not to promote the patient's right to personal choice. Thus, the morality of doctor-assisted death holds many benefits for the patient. You can visualize the benefits of physician-assisted death by reflecting on a time when you've seen a loved one suffering in their final days of life and considering the extraordinary measures you would have gone to help relieve their suffering. Their mental state has significant impact on their understanding of treatment. This choice of end-of-life care is a form of informed consent. A bioethics professional defines informed consent as the process by which the treating healthcare provider discloses appropriate information to a competent patient so that the patient may make a voluntary choice to accept or refuse treatment. This applies to physician-assisted suicide because to be eligible, it must be verified that the patient is participating willingly and is competent. Early preparation is key to any situation. Many people have began adding the heroic measures they desire for if they are diagnosed with a terminal illness. In closing, physician-assisted suicide is a very real alternative to suffering at the end of life. With careful examination of the characteristics of a person to ensure that they meet the criteria of a terminal diagnosis, remainder of life of 6 months or less, and mental stability, assisted death permits a retention of control over the end of one's life. Death with dignity preserves a person's right to personal choice by permitting them to choose the timing and manner of their death. Don't you agree? Think of yourself. Don't you want to defend your right to choosing your own fate? Dying with dignity is a proper phrase regarding the choice to beat your terminal illness by ending your life on your own terms.